Okay, well, hi everyone. I've been given the honor of making a brief introduction this afternoon. So it's great to start the fourth session of our undergraduate research showcase today. We've had three wonderful sessions already. This is always a fantastic opportunity to hear from students and see the results of their learnings during the term. And we're just very happy to be here to celebrate your success in this way. I'd also like to essentially thank all of you for your resilience and adaptability and adjusting to the different kinds of devices that we needed to implement this quarter in order to make things work. So that's much appreciated. Also a shout out to the internship hosts for taking our students on, for providing them with these experiential learning opportunities, which are really critical to the UCCS program and to their education. And again, in particular, under these extraordinary circumstances. And then finally, of course, the staff, both academic and administrative, for making this happen. So I think our format this session will be very similar to the others. Each student will have something like 90 to 120 seconds to give their presentation. The honor of the first question will be granted to any representatives from the internship office where that student interned. And if there are no questions from there, then we'll open it up to the audience as a whole. So without ado, Cindy.
Great, thank you so much, Richard. So our first student is Joshua Alcantara.
Alrighty. Hello, how's everyone doing? My name is Joshua Alcantara, and I'm a UC Santa Cruz student. I will be talking about the clean energy disparity and disadvantaged communities in California. My objective was to analyze the impact of clean energy and accessibility in disadvantaged communities, to assess the disparity of clean energy and how this disproportionately affects low-income communities, and to collect critical data to create an applicable and new policy based on necessary requirements. According to Berkeley Economic Advising and Research, Los Angeles County and the Central Valley account for nearly 75% of the disadvantaged communities in the state. Disadvantaged households tend to be burdened by higher levels of pollutant exposure and suffer from higher than average rates of associated diseases. My method for researching included gathering information from the California Energy Commission Low-Income Barrier Study and the CalEnvirus Screen 3.0 assessment from the California Office of Environmental Health Hazard to identify communities that are low income, unevenly burdened, and vulnerable to multiple sources of pollution. My findings from my research indicate that natural gas power plants in California are unevenly located in disadvantaged communities. My research pointed to the fact that most low-income regions are made up of renters with limited budgets, and this can lead to these communities living in buildings unable to be retrofitted to include renewable energy and energy-efficient designs. My policy suggestions include investing in renewable energy and technologies like solar power and battery storage adoption, as well as a resilience hub for energy assurance. These improvements further economic development by job growth and stimulating the local economy. They also reduce greenhouse gases and produce clean, affordable energy. One way this could be accomplished is by allocating and utilizing funds from the California Cap and Trade program to increase public health, quality of life, and economic growth for disadvantaged communities. Thank you very much.
Great, thank you so much, Joshua. And so this term, Joshua interned with the California Energy Commission. And so if anyone from the Energy Commission would like to go ahead and ask the question, go ahead and raise your hand, and I will go ahead and unmute you. Great. Okay, so CEC Media Office. I just unmuted you. Let me try that again. can you try unmuting on your side?
Yeah.
No, perfect. Great. There we go.
All right. Does that work? Sorry.
Yes, that works perfectly. Thank you.
Joshua? Hi, this is Sandy.
Hi, Sandy. How you doing?
Good. In your look at the issues, what do you think the Energy Commission or other partner agencies should be doing to help either better educate, or awarding projects or research to address the issue that you highlighted?
I would just say investing in education and working with directly with low-income communities to invest and build renewable energy to help stimulate the economy and help them.
Great, thank you.
Great, thank you so much. So great job, Joshua, and Sandy. Thank you so much for hosting Joshua this term. Much appreciated. So, and then we're just going to do kind of one question after each student, and then if we have time at the end, we'll do kind of an open Q&A where any of the questions could be given to kind of any of the students that had presented during the session. So thank you. Great. All right. So our next student is Wendy Rincon.
Hello, can you hear me? Everything good?
Yep, we can see your poster and you sound great. Thank you.
Great, thank you. So good evening, everyone. My name is Wendy Rincon. I'm a student at the University of California, Riverside. And for my research project, I decided to analyze if the healthcare services uphold their medical oath, by which many individuals tend to have state that they are not satisfied with the services that they are provided at a medical institution, to which I hypothesize that this may be because of the geography, race, gender, or background may be affecting the medical services individuals receive at a medical institution. So to start off, I decided to create a set of survey questions to analyze every person's different medical experience and then evaluate my results. Immediately, I noticed that a lot of people tended to have stated that they were slightly satisfied or not satisfied at all with the services provided at a medical institution. So with that, I decided to split my questions, or to analyze two separate questions, the service time and the care time. In my service time, I noticed that a lot of individuals tend to have stated that that the physician spent a lot of time. And by service time, I wanted to analyze how much time did the physician spent with them. Compared to the care time, I wanted to analyze how much of that time that the patient felt that the physician was caring for them. And that's when my results differed. There was a variety in the answers or in the responses from individuals. So in order to analyze that, I decided to look even deeper into the gender versus the care time. And I noticed that males and trans males tend to receive a slightly better care than females. However, when I analyzed the insurance versus the care time, I noticed that individuals who received or who have medical or who have government issued or private issued insurances tend to have or receive slightly less care than individuals who have local government, local insurance companies. So in my conclusions, I did analyze that patients, or the majority of the patients, are not very satisfied with the care being provided. This could be because of the gender, being that females receive less or an unfair care, or because of the medical insurance that individuals have. So as a policy suggestion, I believe that we need to extend our policy number SB 1004, Confidentiality of Medical Information Act, to which the physicians do not have access to know what their medical insurance is, but only the billing and the receptionists have access to. And at the same time, my data, of course, is not a general representation of the Californians, but it is a small population. So I do believe that we need to continue evaluating this issue and identify what could be other causal mechanisms.
Great, thank you so much, Wendy. And so Wendy this term interned with the California Council on Science and Technology, CCST. And so someone from the office wants to raise their hand and ask the question. Otherwise, we will open it up to the general group. Great, Pani, there we go, perfect.
Hi, can you hear me?
Yep.
Great, that was awesome, Wendy, good job. Just really quick question. So reflecting on the survey, is there a question you wish you could have asked that you weren't able to?
Yeah, I wanted to ask if there was I wanted to ask regarding their disease or what they have, to see if there was a treatment or if there was a difference between the treatment. But of course, that's not a question that is allowed to ask. So I changed my questions to identify the insurances to see what kind of insurance every individual has.
Great. Thank you so much, Wendy, for your presentation. And thank you so much, Puneet, to you and your office for hosting Wendy this term. Much appreciated. And our next student is Penelope Chopos.
Hi, can you guys hear me?
Yep, we can hear you and your poster looks great, so thank you.
Okay, my name is Penelope Chiopos and I'm a political science student at UC Davis. My report aims to discuss communities and power plants surrounding them. My hypothesis is power plants have been disproportionately located in disadvantaged communities, especially lower income areas, and communities of people of color are more likely to be affected by the pollution than their white counterparts. While fossil fuel burns cleaner than coal, it is still emitting carbon and other harmful toxins that affect the surrounding communities. Currently in Sacramento, there are 5 fossil fuel plants with no plans to shut them down. I use data from the Energy Justice Network that utilizes the census to compose population structure. I then compared the communities within 1, 3, and 6 miles surrounding the Campo Sud Cogen, Carson Ice Cogen, and Sacramento SCA. My results are that the percentage of white individuals increases as the distance also increase, while the percentage of minority individuals increases as the distance to the plants decrease. On top of it, these communities range from 16 to 34% below the federal poverty line. This is not the first case of disproportionate impacts from industrial toxins on marginalized communities, but it is yet to be addressed as an issue in Sacramento by the plant owners SPUD. Steps must be taken in the future to protect these communities. I recommend Sacramento to introduce a legislator that requires these power plants to shut down and follow suit with Los Angeles's path and begin their transition to clean and renewable sources for the benefit of the community, and in correspondence with California's 2045 goal of becoming net neutral emission. Do you guys have any questions?
Great, thank you so much, Penelope. So this term, Penelope interned with Environment California. And so Dan Jacobson, you're already on it, so I'm gonna call you here. So I just unmuted you.
I think I'm unmuted and I hope you can hear me.
Yes, I can hear you.
Hi, Penelope. This is such a great report and I'm so excited. Do you have any, I guess my only question is, what's holding SMUD back? Like, you know, they're a utility, it's really popular to get to 100%, but what do you think is holding them back?
Well, there's 2 answers to that question. SMUD has generally been very progressive and they've gotten a little bit comfortable. They have not been challenged in a while. And the other answer is that they are hesitant to introduce, to allow people to have solar panels on their houses because they might be afraid that they might lose revenue, but it actually would benefit them in the long run. Yeah.
Great. Thank you so much, Penelope, and thank you so much, Dan, for hosting Penelope this term. Much appreciated.
Thanks, Dan.
And then our next student is Lauren Zarin.
All right. Good afternoon, everybody. My name is Lauren Zarin. I am a 3rd-year political science public service student at UC Davis, and my research focused on identifying if there is a gap between levels of enrollment in charter schools within Los Angeles County, between the general student population, students who are part of some less advantaged groups, and by race and ethnicity of each student. So my hypotheses were that both less advantaged populations and also based on students' racial and ethnic groups, particularly minorities, would face lower rates of accessibility to charter schools within LA County. So in order to analyze this, I collected data on enrollment as well as enrollment in charter schools, finding that approximately 17% of the general student population is enrolled in charter schools, as you can see in figure 1. And then all the other six of the seven populations I looked at that were identified as less advantaged by eddata.org faced lower levels of enrollment with particular help needed for English learners, the homeless population, and migrant students. And additionally, when I looked at the gaps between enrollment by race, I found that some groups like American Indian and Alaska Natives were overrepresented in their attendance in charter schools, while other groups like Filipinos, Native Hawaiian, and Pacific Islanders, and Asian students were underrepresented. And my conclusion and further suggestion for further research would be to look at each of these groups specifically and conduct research looking at the specific obstacles that these groups may face to enrolling in and attending charter schools to make sure that everybody has the equal opportunity to attend these institutions if they would like.
Okay, thank you so much, Lauren. And so Lauren interned this term in Environment California. And so, and Dan already's got his hand up there. Great, thank you, Dan.
Thank you. And thank you, Lauren. This is really interesting. I didn't even know you were doing this. You've been spending so much time on the project we had you on. I had no idea you could do this. But is there an example of someplace where it is working well? Like in any of your research, did you come across and sort of go, oh, here's an example of sort of one place where they seem to be able to do it?
So the research I've done so far, I don't think I'd actually be able to provide you with a specific example of like to integrate so that there are equal populations, equal.
I don't know if everything could be equal, but if you looked around and saw any schools that you might have seen, like this one looks like it's going in the right direction, or this one seems to be doing a little better than the others.
Yeah, I could. I'd have to follow up with you on that. I'm sorry.
Well, luckily we can do that. So okay.
Yes, you guys are both in the same office. So thank you so much, Lauren, and thank you so much, Jan, again for hosting Lauren this term. Much appreciated. And so our next student is Jenna Beth.
Hi everyone, my name is Jenna Bess and I'm a student at UC Davis, and today I'll be talking about disciplinary actions in California schools, specifically a closer look at suspension. With everything going on in the United States today, it's important to be aware of the racial disparities that are present in our school systems, and keeping that in mind, suspension can be used as a tool for exclusionary discipline, and it is also an easily accessible solution for behavioral issues. My research question is, how does the ethnic composition of California schools relate to suspensions? And it's also important to note that ethnicity is one of many factors that predisposes students towards suspensions, and that there's also an active role or an active effort by educators to provide an alternative to suspensions because of the negative impact. And for my research, I did a small N study on 3 California school districts: Sacramento City Unified, San Francisco Unified, and Oakland Unified. I observed suspension rates across 3 ethnic groups in each district. And looking at figure 2, I found that in San Francisco Unified and Sacramento City Unified, African-American students are more likely to be suspended than white students, except this wasn't true in Oakland Unified. And another important finding, also shown on figure 2, is that Latino students are the least likely group to be suspended, except in San Francisco Unified, where the rate was similar to white students. And suspension rates in California are overall on a downtrend when looking at figure 3. Which shows the rate of out-of-school suspension from 2013 to 2017. But it is very clear that African-American students are still being suspended at much higher rates than all other ethnic groups. And every student has the right to equal treatment under their school's disciplinary policies, but students of color seem to not get that same treatment. And as a policy implication and a policy suggestion, there should be an alternative to resorting to suspension, which also leads to missing valuable classroom time. And the state should be providing schools with trained counselors to work with students with behavioral issues. And that is all. Thank you.
Great, thank you so much, Jenna. And so this term, Jenna interned with the California Air Resources Board. And so if anyone from CARB would like to go ahead and ask the question, otherwise we will go ahead and open it up to the general audience. All right, we'll go ahead and open it up to the general audience.
Hi, Jenna. This is Professor Jordan Quila. I can ask you a question here. I guess I was just curious if you had any thoughts on why out-of-school suspensions have gone down seemingly across all groups over the past, several years. If there's any, any research you saw that kind of suggests this, or any kind of, thoughts on that.
Some of the research that I found on that was, it seemed that like I mentioned at the beginning of my presentation, a lot of educators and administrators are trying to work towards better alternatives than suspension because of the negative impacts that it has on students when they miss that valuable classroom time. So I think it's just an active effort by educators and administrators to not have suspension be the first, their first tool in dealing with students that have behavioral issues.
Okay, great, thank you.
Great, thank you so much, Jenna, for your presentation, and thank you, Jordan, for that question. And so our next student is Yakima Huerta.
Okay, is it working?
Yep, we could see the presentation. I think you might need to hit play and to kind of get a little bit bigger. Oh, okay. So it looks like there.
Sorry, is it working? I think my internet's a little bit.
Oh,
okay,
yeah,
perfect.
Great. Thanks, Yakima. Great.
Okay, so hi everybody, my name is Yakima Huerta and I am from UCLA. I conducted a research project on first generation students at the University of California. So the University of California's first generation population makes up 41% of all UC undergraduates, and as figure 1 demonstrates, there has always been a gap between first generation students and non-first generation students for many years. My research question is, how do academic programs tailored to first generation students in a UC impact the 4-year graduation gaps between first generation and non-first generation students at that UC? My hypothesis is that the higher quality the first generation programs a UC has, the smaller the graduation gaps will be for that UC. I created a program evaluation to look at the resources each UC provided their first generation students. While collecting data, I decided not to include Pell Grant recipients in order to control for the effect of income on graduation. So figure 2 demonstrates the program evaluation, and it evaluates whether universities facilitated the transition of first generation students into their campuses and whether first generation population was celebrated in order to determine if there was a sense of inclusion on campus. Also, the evaluation focuses on whether the UCs provide financial assistance for their first generation students, such as first generation scholarships. And it also looked into other programs such as informational programs for students that want to study abroad. And of course, mentoring and counseling services were analyzed as well. My findings show that UCSD had the highest program evaluation score and the smallest gap between both of these populations. And similarly, UC Berkeley had the lowest program evaluation score and the highest graduation gap between both of the populations. This then goes into a discussion of whether UCs should develop high quality first generation programs and services in order to narrow that gap between both of those populations. Thank you.
Great, thank you so much, Yakima. And this term, Yakima interned at the Cal EPA Legislative Affairs Office. And so if someone with the Cal EPA Leg Affairs had a question, just go ahead and raise your hand and I can go ahead and mute you. And if not, then we can go ahead and open up to the general audience.
Hi, Yakima. This is Travis Baker, your professor for PO 195 here at UC Santa Sacramento. Thanks for showing us this data. This is really interesting to see the close matchup between the services offered to these first generation students and how well they do as far as graduation rates. I was just wondering if maybe you could kind of give us maybe a hypothetical example of away from the numbers and towards more of the actual experience, like what would it look like for the student who doesn't have the support services or maybe the student who does have the support services and how they kind of end up making those graduation progress?
Yeah, so I actually, the way I got like the student experience data was like I went into their UC websites, and then I watched like a lot of the students' videos. So it was basically just kind of listening at every UC what every student has said and what every student says helps them, and then that's kind of like what helped me develop like, okay, I should analyze this based on this, because it's like a constant theme throughout all the UCs that a lot of first generation students like talk about. So that was like kind of like quality data, I guess you would say, but it was, yeah, it was like a way to help analyze like the student experiences, because it was like a lot of common themes throughout the entire thing.
Great, thank you so much, Yakima, and thank you, Travis, for the question. And then for Cal EPA, if there's anyone that I'm just gonna give folks just a little bit of time here if you wanna raise your hand. And then if not, we'll go to the next student, so. Yes, Kathy, I just unmuted you. My unmute may not be, Kathy, if you can try unmute slide as well. Oh,
can you hear me?
Yeah, we hear you. Thank you. Sometimes.
Okay. Hi, Yakima. Thank you. Good job. Yes, I think this is very interesting, and also just wanted to thank you for your environmental work that you've been doing for us. It's fantastic. So thank you. And thanks for letting me be part of this presentation.
Great.
That's it.
Thank you so much, Yakima, for the presentation. And Kathy, thank you so much for hosting Yakima this term. We much appreciated.
Oh, it's our pleasure. Thank you.
Thank you. And our next student is Amy Schwanhauser.
Okay, I think we're good to go. Hi, my name is Amy Schwanhauser, and I studied the effects of arsenic exposure on children. And in children, arsenic causes, it interferes with their cognitive functioning, which can be measured in learning and memory deficits, verbal comprehension, and IQ. Children are also more vulnerable to arsenic poisoning because they ingest 40 to 90% more heavy metals. In California, the maximum contaminant level for arsenic is 10 parts per billion, and in 2018, 221 out of 333 violations were in the Central Valley. So my research objective was to determine whether the presence of arsenic in school water systems affects academic performance. And I hypothesized that students who are exposed to water that has more than the legal amount of arsenic would have lower test scores than students who are not. And I compared 2 pairs of elementary schools with similar demographics. And I took their California assessment of students' performance and progress scores. And in each pair, 1 school surpassed the legal limit. And as you can see in the bar charts below, in Madera County, North Fork Elementary actually had more failing scores than the school with safe water. So that seemed to track for a second. However, in Tulare County, the English CASP scores were relatively similar, but at Elbow Creek, which had no arsenic, there was actually a greater number of failing scores. So my findings are ultimately inconclusive, but they do suggest that there are disparities among students in the Central Valley and the rest of California. All 4 schools had greater percentages of failing CASP scores and water systems. It's likely that these are a result of existing infrastructure, nutrition, exposure to other metals, and also district funding. I would recommend that there are broader arsenic testings for K through 12 schools, as well as counties, because we need a way to track and inform consumers of the dangers. And lastly, in order to make sure that children are safer, I would also recommend water filtration systems, especially in areas that are already disproportionately burdened by existing water inequalities. thank you for listening.
Great, thank you so much, Amy. And so we'll go to questions now. Now I know that your internship host site actually has a conference today, and so
Yes,
we'll just go ahead and open it to, and unfortunately cannot be here, so we'll open it questions to just the general audience then. If you have a question for Amy, if you want to raise your hand.
Hey, Amy, I'll ask the question. This is Professor Jordan Quila from your Poll 96E class, the class that you're doing the poster for. So I'm looking at your elementary school profiles, and it seems like you picked kind of fairly similar schools with differences in arsenic level. I was just kind of curious at how physically close are these schools to one another within these areas?
So some of these schools are actually within like a 15 to 30 minute drive. It really depends, and I probably should have that down in miles instead of driving, because not everybody drives to school and buses would take longer as well. So all of these elementary schools are actually on their own private water systems. And so although they may be, I realize that even though maybe they're only 15 to 30 minutes apart, that doesn't really account for the water exposure at home, which is an entirely different water system. But two kids going to the two different schools, let's say Oak Valley and Elbow Creek in Tulare County, might be using a different water system, the same water system at home, but different water systems at school. So the distance there I kind of tracked off a little there, but there is some overlap there for sure, despite the difference.
Yeah, great, thank you.
Great. Thank you so much, Amy, and thank you, Jordan, for that question. And so our next student is Cara Idiozo.
Okay. Hi everyone, my name is Cara Idiozu, and I'm here today to discuss the effectiveness of California's measures to address food insecurity. So California dedicates a hefty part of its budget to address food insecurity. However, only 70% of those eligible are actually reached.
Cara, you're actually not sharing your presentation.
I'm not. Why do I always miss that? Okay.
Okay, perfect, great, thank you.
Shall I start again? Or?
Yeah, that'd be great, thank you.
Okay. So hi everyone, my name is Cara Idiozu, and I'm here today to discuss the effectiveness of California's measures to address food insecurity. So California dedicates a hefty part of its budget to address food insecurity among the poor. However, there are only 70% of those eligible that actually receive benefits, and there are still concerns as to whether the resources ensure that program participants have a balanced diet. So I hypothesize that there's a relationship between SNAP benefit usage and health outcomes. As usage increases, then the incidence of particular health outcomes would increase as well. The outcome of interest in this study was diabetes. So I observed 5 counties over the years 2014 to 2016, and then measured the development of diabetes and SNAP participation in each of these counties. I only grouped counties with similar population size, income, and poverty levels, and then found that there was a significant difference in the prevalence of diabetes in the counties where there was high SNAP participation. You'll see group 1, figure 1 on my poster. And then I concluded that further research is necessary to obtain specific data on the specific preferences of SNAP users. And that the biggest implication of the findings are that certain racial and economic groups will be more prone to negative health outcomes, such as diabetes. As for policy changes, I'd recommend the expansion of program user monthly allowance and mandatory nutrition or health ed for prospective program users. Overall, the CalFresh program seems to have a few flaws, but these can be overcome by more accommodations for program users, education, and recruiting more eligible Californians. Thank you.
Great, thank you so much, Cara, appreciate it. And so Cara interned with Political Solutions, and so if someone from Political Solutions would like to go ahead and ask the question, go ahead and raise your hand, and I'll mute you. Otherwise, we'll go ahead and open it up. All right, we'll go ahead and oh, there we go. All right, we'll go ahead and at this point right now open it up to general questions. And Marshall, you have a question?
Hi, yeah, this is Marshall, also a student at UCCS. I was curious because you said in one of your policy suggestions to increase the user awareness of the benefits of healthy food. How do you think that the program would go about doing that? Would they collaborate with universities to possibly provide like online education for that, like maybe a pamphlet that they give out? How would you see that becoming concrete?
Yeah, I actually saw that happening in a few different ways. One of which being like mandating program eligible residents to participate in like a webinar or an in-person seminar, or actually sending people from the CDSS, the California Department of Social Services, to these areas that are maybe hard to reach or like more rural, and actually having volunteers disseminate literature to residents of these areas.
Great, thank you so much, Kara, for your presentation, and thank you, Marshall, for your question. And so our next student is Shreya Kulkarni.
Hello, can everyone hear me?
Yep, we can hear you, Shreya.
Okay. Oh, one second. Let me
yeah, I just need to.
Sorry about that. Okay.
That's great.
Okay. So my research today is about Medi-Cal health insurance coverage and infant mortality rates that are especially high in Black populations. And so Medi-Cal health insurance coverage has raised infant and maternal mortality rates of Black women. However, as seen in Figure 1, there's a substantial difference between rates of mortality for Black mothers and infants in comparison to other races. So my research question asks about the association between Medi-Cal usage of Black women and infant mortality due to pregnancy-related complications. Black infant mortality rates let researchers make conclusions about Medi-Cal and its ability to provide proper coverage to Black mothers. And so I hypothesized a positive correlation between the number of women on Medi-Cal health insurance and pregnancy-associated infant mortality, indicating that Medi-Cal may be lacking in its ability to provide essential services to Black mothers. And then my hypothesis was tested by identifying counties with the highest rates of Black women on Medi-Cal health insurance. And these include the regions that are the darkest shade of blue in Figure 2. I then found the coefficient of determination through a linear regression with about 26% of the variation in Black infant mortality data explained by the number of Black women on Medi-Cal in the county. And so this slight positive correlation between Black women on Medi-Cal and Black infant mortality shows that there may be issues for Black women on Medi-Cal during pregnancy. And so my research confirmed my hypothesis. Documenting Black mothers and their experiences on Medi-Cal and improving access to data will allow researchers in the future to understand possible implications. And so for Black women in America, there are already a lot of social stressors that impact their pregnancies and their ability to access health insurance. So research on how chronic stress and allostatic load can allow health services in the future know how to better serve the people. And then to improve pregnancy-specific outcomes, Medi-Cal coverage of a doula who provides constant support could also reduce possible impacts. And so while this research is inconclusive because it calls for future research and access to a larger data set, it identifies a possible correlation between Medi-Cal and infant mortality rates and provides insight into maternal health outcomes for the Black community. So if anyone has any questions.
Great, thank you so much, Shreya. And so this term, Shreya was in the Health Access Policy Office. If someone has a question from Health Access, then I'll go ahead and I can just raise your hand and I can unmute you.
I have a question.
Okay, great. Why don't you go ahead and then Tom?
Did you look at other control variables in this model? I mean, did you build a model that sort of looks at what, that shows what these relationships are like?
I tried to. So basically what happened is in the process of accumulating data, I came across a lot of issues with just access to specific data. And so controlling my variables is something that I mentioned in my in what I concluded, but I tried to be as specific to Medi-Cal as possible. So I used Medi-Cal eligibility data, and I used individuals who access Medi-Cal, and then I also used infant mortality rates specific to pregnancy complications, so that I could try to limit the amount of variation. But of course, I can't. That's why I couldn't specifically conclude anything, is because there is a lot of variation in my findings.
It seems to me that you almost need to do linear hierarchical modeling on something like this, because from just what I can tell from this, and I'm sure you've got much more there than you can possibly do in this short presentation, but there's a kind of it's kind of a two variable model. I mean, it's kind of, here you have women on, who get a Medi-Cal, and then you have this dependent variable outcome. And I'm just wondering how many other variables there are that sort of, would shape or create different kinds of conditions. I mean, that is to say that being on Medi-Cal means more than just being on Medi-Cal. I mean, there's a whole gestalt around that. See what I'm saying?
Yeah. No, definitely. And I recognize that. And so I did say that a lot of what I ended up researching could potentially have future research implications. And we do need to do a lot more insight. I was just saying that in general, there are spaces in terms of quality assurance and things like that we can improve for Black mothers, and that's just kind of where my research was centered.
Yeah, no, it's good. It's really an important question. I hope you stay with it.
Thank you.
Great, and thank you, Tom, for the question, and thank you, Sherry, for the presentation. I did want to just for health access, if someone wanted to, I just want to give just a 15-second pause here. If any one had a question, I can go ahead and unmute you. So if you can just if you want to just raise your hand. Otherwise, we'll go on to the next student. All right, thank you so much, Ray, appreciate it. And so our next student is Sabrina Zunich.
Hi, can you hear me?
Yep, we can hear you. Great, thank you.
Hi, my name is Sabrina Zunich. I'm a student at the University of California, Davis. And before I get started on my presentation, I'd like to offer some trigger warnings. So trigger warning for rape and sexual assault. As we all know, California has been no stranger to a history of social and political movements regarding human rights. But despite the recent events of the Me Too movement and women's rights marches, sexual assault rates have continued to climb annually. And the issue of sexual assault is not only present but prominent, as the reported statistics are 5% higher for women and 10% higher for men than the national average. So what is the state doing to help end this violence? In this project, I set out to examine whether there's a relationship between rape crisis program funding and reports of sexual assault across the state. I look at the use of RC programs and facilities as a means of investigating state budget use for survivor resources. And my hypothesis was that the increase of RC programs funding resulted in an increase in reported statistics, as these crisis facilities allowed the survivors resources in order to come forward and seek justice through reporting. I used observational study methods to observe the change in RC program funding and did a cross-comparison analysis of statewide reporting statistics. I then honed in and categorized the different funding sources to determine state fiscal responsibility. And I looked at rape crisis center services to determine if these programs were being utilized and better during this time frame. And from my research gathered, my hypotheses are confirmed. I would like to note that there are countless external factors. This is a very difficult topic and you can't determine causality, but my findings do reveal there's a steady increase in reporting statistic rates over time in conjunction with the creation of comprehensive survivor resources. Therefore, there's a positive and direct relationship between RC program funding shifts and reporting statistics across the state. This research is significant for California and public policy because it provides a fundamental and basic foundation for those who've had their rights violated. And as such, my policy recommendation is to increase state budget funding to the Rape Crisis Program grant to help our survivors seek justice. Thank you.
Great, thank you so much, Sabrina. And so Sabrina this term interned with Capital Weekly. And so if someone from Capital Weekly want to go ahead and ask a question, just go ahead and raise your hand. I can go ahead and unmute you. All right, or otherwise we can go ahead and take a question from the audience.
Hey Sabrina, this is Professor Jordan Quila. I had a question about, so you look at kind of general funding and kind of the relationship with reporting. I was wondering if you had any thoughts on the types of programs that might be more beneficial, like within this, like, because they're kind of different, you kind of show them with like different aspects of it. I was wondering if you had any thoughts on within those things, what are the best ones that in terms of helping?
Yeah, so I would say if you look at figure 4, that looks at the Rape Crisis Center services performance over the years that I examined. And the most important that it shows is that the crisis intervention services, and in my opinion, I believe that to be the most vital resource, because survivors who are coming forward to these programs and facilities are looking for perspective and insight on how best to seek justice. And so by having volunteers for crisis intervention, they accompany them to both medical examinations and to legal reporting scenarios by either pulling in officers or going to police stations to give reports. And I think that kind of push by the crisis intervention volunteers help survivors get the justice they're seeking.
Great, thank you.
Great. Thank you so much, Sabrina, for a great presentation. And thank you so much, Jordan, for your question.